But tell them a little bit about, you mentioned kind of tummy tuck, you mentioned microsurgery. What's that all about?
Yeah, so preoperatively, you plan it out by getting a CTA scan. We routinely do that to map out where the blood vessels come up through the abdominal tissue and supply the skin and fat of the abdominal wall. That way, we can know exactly where to go to identify these vessels to make the surgery go predictable and smoothly.
So so you're having you do this scan and it shows you blood vessels. So these blood vessels are going to the lower part of the tummy, is that right?
That's correct. Right,
Eh,
all or pretty much all around the umbilicus, around the belly button. Usually more inferior is the ones that we're targeting, right below the belly button. And we mark them with a pin, and then we know where to expect them because they can be in a lot of places, but we know exactly where to expect them on a patient so that when we go in, we're like, okay, this is where it's coming up. I need to kind of slow down and look for it to allow us to get to it very safely and carefully because like I mentioned, it's spaghetti strings. I mean, it's 2 to 3 millimeter blood vessels and smaller, really, where you get close to the flap. So you cannot be, you have to be very gentle. You have to very carefully. Your assistant that's holding has to just barely retract with just the right amount of force, and pull too hard, they can pull the pedicle off. So they're just holding barely, and you're constantly adjusting. But you have to. There's a thing in surgery where we develop a sense for sterility. We all know hands above waist and all these general things. Well, that's the next level of awareness of, we have our general surgery style of being a little more rough with things. And it's kind of like reminds me of the late great Dr. Kennedy that trained us. He's like, it takes about 6 months to beat that general surgery out of you. He kind of, as far as he's talking about being finesse, because in certain professions, you don't have to be as, because general surgery and then a lot of things we do in plastic surgery, tummy tucks, you don't have to be as finesse with some of those things. But this surgery, you have to develop that sense of being
A real
very
microsurgery, right?
microsurgery minds of everything is very delicate. You are in a china shop. You have to sit here and just peel it away. We're not in a hurry. We're removing, but you cannot, you mess that vessel up, you ruin the surgery. So every little step matters. And so you're clipping each branch of the tree as you're going, marching down into the belly. And then being, underneath the microscope, your loops. And then you're taking that and then you're transferring it. So
So wait, you're using, just to clarify, you're using the fat that you would have, if this lady didn't have cancer and she were a tummy tuck patient, you're using the same skin and fat that you would have just thrown in the garbage. You're finding the blood vessel that nourishes that, and then you're going to make a breast out of that.
that's correct. Just using mostly the fat and only a little bit of the skin to make a new areola. And
That's pretty amazing.
it is amazing. And I always tell patients that it's like with like. It's transferring fat to an area that had fat.
That's plastic surgery 101, right? Replace
That's
like with
right.
like, right?
That's right. That's right. So it's very satisfying for that. And the general surgeon removes the breast tissues, checks on some lymph nodes typically, and then after that we then dissect in between the ribs, just removing a little bit of cartilage of the rib near the sternum, and find those little mammary blood vessels that are the same size as the vessels from the tummy, and we connect an artery to an artery and a vein to a vein, and you like got blood flow in, blood flow out. And I always make the analogy for people. I say if you take New Orleans and you cut the interstates off and the causeway and all the bridges, and we go plant it in the middle of anywhere America, and we just hook up the causeway again, eventually other roads are going to reconnect again. And that's how the flap works. So the body naturally will come in and say the outer skin will then make new blood connections to then make new roads. So later on you could technically cut that main pedicle where we anastomose, where we connect it to the chest vessels, and it would still survive. We don't do that, but that's how magic the body is. It's very neat and beautiful the way it works.